From RareGem Productions, this is your Monday morning meeting. Monday morning meeting where we take time to discuss, to get to know a little better, to explore, and to dive deeper. In our morning meeting, we're going to take some time to get to know Medi-Plex home care professionals.
Well, wound care and wound care supplies is something that people don't talk about a lot. However, it's 65 million people who have wounds. And you don't hear a lot about it. You don't hear anybody doing anything with wound care supplies. So we wanted to have a unique model. It could be a gunshot wound. Right. It could be a spinal cord injury. It could be a amputated arm. It could be a large part of the body. And if it's a large part of the body, that's a considerable amount of wounds. Wounds are very costly.
Yes.
It comes down to dollars and cents.
Yes, it does.
They're very, very costly.
Getting to know the business that's caring for you with founder and CEO Glenda White. We'll be right back. I'm Jade Harrell.
If you or a loved one are discharged from the hospital and need help, call on Medi-Plex Home Care and Hospice. With our comprehensive home health services, our professional and caring nurses and therapists will come to your home, assess your medical needs, and work with your doctor to design a plan of care. Medi-Plex is a Medicare certified agency, which means that Medicare will pay for your home health care needs. Remember that you have a choice in home health care. Let your doctor know that you choose Medi-Plex Home Care and Hospice.
Grace Hill and the Whitaker Foundation present Grace Hill Whitaker Urban Evening Series, Thursdays, 7 to 9 p.m., June 12th through July 24th. A free summer outdoor concert series. A tremendous good time for a great historic community. People listen to great music, interact with neighbors, and experience an invaluable community building opportunity together at St. Louis Place Park, Rauschenbach and St. Louis Avenue. Enjoy Charles Skeet Rogers and the Inner City Blues Band. Disco nights featuring Coco Soul. Fat Pocket, the Coleman Hughes Project featuring Adrienne Felton, Tribal Funk, and the dynamic Brian Owens. For more information, call 314-584-6900. On Facebook at Grace Hill St. Louis and Twitter, Grace Hill STL. Sponsored by the Whitaker Foundation. RareGem Productions proudly presenting The Positive.
Divine Design Hosiery presents its 10-year anniversary concert featuring Dottie Peoples. Saturday, June 28th, 6:30 p.m. at Friendly Temple Missionary Baptist Church, 5515 Dr. Martin Luther King Drive in St. Louis, with special guest Greg Heavy Guitar Hayes, Jewel and Converted, and Cheryl Brown. Come celebrate Divine Design's 10-year anniversary concert featuring Dottie Peoples live. Saturday, June 28th at Friendly Temple Missionary Baptist Church. A portion of the proceeds will benefit the community Women Against Hardship. Tickets can be purchased at Friendly Temple Missionary Baptist Church, Transformation Christian Bookstore, Drop Shop Beauty Salon, Rib Shack Downtown, Afro World, and the Community Women Against Hardship. Or call 1-800-518-9646. 1-800-518-9646. Or go to www.divinedzIon.com.
RareGem Productions proudly presenting The Positive. Need quality care and support for your loved ones with illness? Want them to live as fully, independently, and comfortably as possible? Well, come on in and get to know Medi-Plex Healthcare Professionals. It's Medi-Plex Mondays with RareGem Productions, proudly presenting, promoting, and producing positive programs. And we're back, and our morning meeting is focused on community today, and I'm joined again by Miss Glenda White, founder, executive director, president, CEO, an idea maker, visionary for Medi-Plex Healthcare Professionals. But there's another aspect of the business that is a nonprofit arm. Tell us a little bit more about that.
Our nonprofit arm is Total Rehab Programs, and the acronym is TRP. Under TRP, we have a wound care program, whereby we give out free wound care supplies, over-the-counter wound care supplies, for people with acute and chronic healing or non-healing wounds. And we give those supplies out totally free of charge. A supply bag comes with 200 4x4s, 200 2x2s. We give out normal saline, a barrier cream, and we also give out tape.
In order to address the wounds. Now, why do you do this?
But we do that as a means of giving back to the community. As a registered nurse, I know how hard and how difficult it is for wounds to heal. And depending on the other diseases or comorbidities that you have, it may be almost impossible for wounds to heal. And then on the other hand, wound care supplies are very expensive. So therefore, for people with limited income, it's almost virtually impossible for them to afford wound care supplies, because with non-healing wounds or large wounds, you have to change those bandages daily.
Every day.
A lot of wound care supplies.
Mm-hmm. What are the consequences of an untreated wound of that nature, of that magnitude?
The consequences are wound infection, amputations, depending on the wound, death, rehospitalizations, depression. There's a multiple range of different things because of non-healing wounds.
Exactly.
And definitely depression. If you have a wound that you have to bandage and you don't have the bandages for it, a lot of times you do become depressed because you have to use whatever you can in order to actually wrap and heal and cover those wounds, besides visiting wound care centers and clinics and nurses coming out to change those wounds. You need clean, fresh bandages for those wounds to heal properly.
Now, Tanisha came on to share about how the other aspects of wound care are also necessary. You mentioned depression, and even in one of our previous episodes, you talked about how some of the social services you incorporate help people in their circumstance that need this kind of health care. You could have, with a company of your size and ability, you could have donated money to a cause. You could have addressed a number of other social concerns. But from your business model and from your nonprofit, there's something deeper here. How did you know that this would be that area? And tell me how it is that you assigned your nonprofit focus to be that.
Well, wound care and wound care supplies is something that people don't talk about a lot. However, it's 65 million people who have wounds. And you don't hear a lot about it. You don't hear anybody doing anything with wound care supplies. So we wanted to have a unique model. But besides that, the healthcare industry and nursing in general, we see a lot of wounds. And we know how difficult they are to heal. And we do realize in the healthcare community how people shy away from wounds. If you have a wound, sometimes people will be hesitant to accept you into their system, depending on the comorbidities or the different diseases that you have that may hinder that wound from healing. And depending on the size of the wound, it could be a gunshot wound.
Right.
It could be a spinal cord injury. It could be an amputated arm. It could be a large part of the body. And if it's a large part of the body, that's a considerable amount of wound. Wounds are very costly.
Yeah.
It comes down to dollars and cents.
Yes, it does.
They're very, very costly because the wound care supplies are costly, especially if you're changing them every day.
Right. And the requirement for them to heal is that they're changed every day.
Clean white bandages that a lot of times that you actually change those bandages daily.
Do you include an education component to that? So I would imagine, and we've seen it, if you don't know better, you don't know necessarily what to do. So not only if I can't afford to treat the wound, do you also include how I should, what is important, and some things I could do to make sure I'm healing properly?
Well, we don't want to be a clinic. We do not want to have the federal government assume that we're a clinic. So therefore, we do not go out and address the wounds. A lot of patients that we give the wound care supplies to, they are already connected with a wound care clinic or a physician. However, after you see the physician, if you see your physician weekly, once you see him one time that week, he may dress your wound that one time. And if you need daily continuous dressing changes, then we provide those dressings and you do it the remainder of the week.
Yeah.
That's how we do it.
That's good to clarify.
We give education materials on smoking cessation.
Okay.
Because if you smoke, that impacts the healing process of the wound. We also give booklets and brochure on nutrition. Good nutrition is vital for the wound to heal. So we do give those things out as well.
That's right. And you give out those kinds of things for information. Now, the costs to supply this have to be tremendous for you as the provider. So with this being a nonprofit, what is the best way that we can help you continue your mission and reach the people that you're helping?
If we needed the community to help,
which we do.
Yeah, we do.
We don't
need
do
the
it
community
alone.
to help. We accept donations to purchase additional wounds. All of the monies that we get for TRP or the wound care program go directly to purchase wound care supplies. And we also need volunteers, volunteers to help bandage, the package up the packages with the wound care supplies, and also volunteers just to work in the office with the program.
Yeah.
So we do need that. And we're definitely in need of some good grant writers.
Okay.
So if we have any good grant writers out there,
That's right.
we are definitely in need of some grant writers to help us write some grants so that we can continue the program.
That's right. How do you get the supplies to those in need?
We actually have 4 locations. We have a location at the Page YMCA. We have a St. Charles location at that YMCA. We have a location distribution center at the YMCA on the south side, and we also have a distribution center on Emerson in the city. So we have 4 distribution centers. We distribute once a week for 3 hours.
And what has been the influx of recipients at these locations? What have you seen?
Well, we get most of our recipients from the hospital. We do partner with the hospitals as well and wound care centers for people who do not have the ability to pay.
Right.
So we have a large Medicaid population, and also
So they do refer to you.
Yes, they do refer to us.
I bet.
Right, they refer to us, and we also exchange supplies for our data worksheet card. We do that every week.
Data worksheet card?
Yes, we have to fill out demographics on everyone that we give the supplies to, so we can keep that to illustrate that it's a need.
Right. Help us, you talked about dollars and cents. Help us understand the need. How big is the problem?
The problem is very, very big. And you have to realize you have a lot of paraplegics, quadriplegics, and if you are not able to walk or ambulate, most likely you have some type of pressure ulcer, whether it's a stage 1 to a stage 4. We have a lot of young men in the black community who are paralyzed, who's had gunshot wounds, bed-bound. We have those, and then don't forget our diabetics.
Right.
We have a lot of diabetic foot ulcer, diabetic wounds. We have some people who may be overweight, who have varicose veins or viscosities on our legs, and we have weeping legs, and we just have traumatic injuries, such as a car accident.
Sure.
You can lose a limb or burn victims. So it's quite a few people.
I could see how we would take that for granted, because all of those require continuous, constant changing of bandages for these wounds.
Correct.
Share the compassion and love that you have for the people that have this need, because it took real heart behind this.
Yeah, we had a young. When I first got into nursing, I realized that it was a need to provide wound care supplies to people who could not afford the wound care supplies if they needed daily, twice a week, 3 times a week dressing changes. And I ran across a young man, and I never forget, he was a gunshot victim, and he was in and out of the hospitals. And the main reason why he was constantly in and out the hospital was because he didn't have dressings. So if you don't have clean dressings to dress the wounds, you're going to have infections.
So he was back and forth with infection.
He was back and forth all the time. And I was actually the nurse that was sent out to take care of him. And while I was there, the first thing he stated when I walked into the home, he was a young man in his 20s, do you have my wound care supplies? And he seemed to be very hostile and aggressive. I didn't know why. But later on, I figured out why. It's because he had been in and out of so many systems, so many hospital systems, so many places, whereby when he would come home, he would not have the wound care supplies, and he needed the supplies. He was on Medicaid. He could not afford the supplies. So he was very, very upset.
Yeah.
Because he would have the nurses come in, no one would have these supplies for him. And just from that situation early on in nursing, I realized that it was a need.
Yeah.
We should have actually named the program after him.
Okay.
But we didn't do that. We just named it the Wound Care Supply Program. And I realized that it was a need. And from there, we've just always, even our organization, sometimes depending on the wounds, we have to shy away from it. But if they do not have the ability to pay, we don't really have to shy away from it anymore.
Because
because we can provide you the wound care supplies, which we give you a month worth.
Nice.
We give you a month worth at a time.
You give them a better chance to succeed.
Yes, we've had a lot of success stories.
Yeah.
People who do not go back in the hospital, people who are at home, people whose wounds have healed. And we're going to put those out on our website so people can read about them. And I know a lot of times that community of people, we don't really think about it.
Right.
But if you had a loved one who had diabetes, who's had a diabetic wound, someone who's in a wheelchair, who cannot move around, who is bedbound, if we have had someone that has a mastectomy, anyone that has been in the hospital with surgery. It could be surgery. You don't
many
have
scenarios.
To, you don't have to be someone who doesn't have the ability to pay. You could be someone who's just off work right now on sick leave.
Right.
And maybe your insurance don't pay for it.
Right. And there are lapses in places and scenarios where you find yourself out. Yeah.
Right, where you need the help.
And you're right there to fill in.
That's right.
Let us know how we can connect, how we can contribute and find you to be sure that we're supporting TRP.
Well, you can call Medi-Plex at 314-993-5580. And you can ask for the Wound Care Assistance Program.
That's right. If you have a need and if you want to help with the need.
Exactly. If you have a need, if you want to volunteer, and if you want to help with the need.
That's a wonderful.
You can call us at any time, and we're there, and we welcome the help and the support. We definitely welcome any donations. We do welcome that. And again, as I stated, we are looking for a few good grant writers to help us with this need.
That's right. So many ways and such a tremendous need. And yet again, another fine example of what Medi-Plex is doing sincerely, completely, and wholly for their business and this community. Thanks again, Glenda.
You're welcome.
Medi-Plex Healthcare Professionals, LLC, strives to provide quality care and service with you in mind. Since 2002, their business is caring for you. They have skilled home health services in nursing care, physical therapy, speech therapy, occupational therapy, home health aid services, and medical social services. With 2 locations in St. Louis and Swansea. For questions and referrals, call 314-993-5580 in Missouri or 618-222-6778 in Illinois. Visit them on the web at mediplexhhc.com. This is your Monday morning meeting with Jade Harrell, another positive production of RareGem Productions, proudly presenting, promoting, and producing positive programs. Learn more at OneRareGem.com. That's OneRaregem.com. Thanks for listening.